This module is designed to provide an overview of drug diversion prevention for healthcare facilities. The module includes information on commonly diverted drugs, risk associated with diversion, and basics for developing a drug diversion prevention program. References have been included at the end, as this is not a comprehensive review of all drug diversion prevention practices. This is also not a substitution for medical or legal advice. Every institution should be advised by counsel in legal and regulatory matters.
The rate of pharmaceutical drug abuse has grown significantly in recent years. As of 2006, nearly 7 million Americans were abusing prescription drugs, more than the number who were abusing cocaine, heroin, hallucinogens, ecstasy, and inhalants combined. That 7 million was just 3.8 million in 2000, an 80% increase in just 6 years. So, what is drug diversion? When prescription medicines are obtained or used illegally, it's called drug diversion. Drug diversion can be defined as any criminal act or deviation that removes a prescription drug from its intended path from the manufacturer to the patient. Misuse of painkillers represents 3/4 of the overall problem of prescription drug abuse. Injectable drugs are not the only type of drugs diverted. Pills can be abused and diverted as well. Hydrocodone, or Vicodin, is the most commonly diverted and abused controlled pharmaceutical in the U.S. Other commonly diverted drugs include oxycodone, Xanax, and oxymorphone. Promethazine, or Phenergan, a drug that is not a controlled substance, has also commonly been abused and diverted. Drug diversion can happen anywhere controlled substances can be found and are left unsecured. Often hospitals are viewed as the setting where drug diversion typically happens. However, drug diversion is not unique to the hospital setting, and hospitals are not the only setting where prescription drugs are diverted. Facilities such as ambulatory surgical centers, long-term care facilities, pain clinics, and pharmacies all have the potential to have drug diversion activity. In healthcare settings, there are a number of risks associated with drug diversion. These include bloodborne pathogen exposures that could potentially result in an outbreak of an infectious agent, patient safety issues such as healthcare provider impairment during work hours, patient pain issues resulting from pain medications being withheld, and healthcare provider overdose. For the purposes of this webinar, we will focus on the risk for the spread of infection. One challenge in the recognition of a diverting colleague is the preconceptions about who can become a diverter. For example, staff may assume that a diverting healthcare worker will be a poor performer, a loner, or someone with a significant disciplinary record. However, there is no typical profile of a prescription drug diverter. Diversion of prescription drugs occurs in a variety of ways by all segments of our population, in all neighborhoods, and in all workplaces. Two factors that make healthcare workers vulnerable to drug abuse and diversion are high stress and drug accessibility. Often healthcare workers are present when patients are in pain and work under harsh demands for perfection. This can lead to high levels of work-related stress. Healthcare workers also administer medications often and may have witnessed the benefits of a drug, prompting them to try the drug. Also, constant handling of medications may decrease the respect of the medication's addictive properties.
Although drug diversion is difficult to completely prevent, it is important to recognize it quickly and address it once it has been identified. A program to address drug diversion should include 4 components: education, policy, implementation, and reporting. Education of patient contact staff at all levels brings the most relevant staff into the surveillance program as a first line of defense. Education about diversion should be part of every new employee orientation, and clinical staff should receive an additional training session devoted exclusively to the topic. Diversion education for clinical staff should emphasize the impact of diversion on patients, the institution, and the diverting employee, and should outline methods of prevention, detection, and response. Diversion has to be handled with uniform procedures. Policies should establish how drugs are to be handled, who is responsible for monitoring controlled substance transactions, and how potential diversion is handled. The content of drug diversion policies is driven by patient safety and regulations. Regulations require that patients receive care in a safe setting and controlled drugs be kept securely. Drug security and handling policies need to cover diversion risk areas relating to controlled substance receipt, storage, transport, and handling within the facility. Implementation of a diversion program should be in the hands of someone with clinical knowledge. Some facilities use a multidisciplinary diversion team led by a diversion specialist, while other facilities use a diversion specialist who may work more independently and collaborates with others as appropriate. Ideally, the diversion specialist will have a clinical background, knowledge of medications used within the facility, and the ability to conduct an effective investigation. The diversion specialist or team will serve as a resource to the staff, oversee education and policy development, and will ensure that all diversion-related activities are documented. A significant number of facilities do not report drug diversion. However, reporting of diversion is an essential part of the response. Federal regulations, state laws, and professional boards mandate reporting. Furthermore, reporting protects patients against diverters. Facilities that fail to report become complicit in subsequent patient harm and risk harm to the diverter who is allowed to continue unchecked. It is important to develop a collaborative working relationship with local law enforcement so that diversion cases can be handled appropriately. For more detailed information on developing a drug diversion prevention program, view the supplemental module titled Guard Your Meds. In summary, drug diversion is universal among healthcare facilities and can happen anywhere controlled substances are left unsecured. Though there is no typical profile of a prescription drug diverter, high stress and drug accessibility make healthcare workers vulnerable to drug abuse and diversion. All employees with patient contact or clinical responsibilities need to be educated about diversion. Policies should establish how drugs are to be handled and how potential drug diversion will be handled. Implementation of a diversion program should be in the hands of someone with clinical knowledge, and federal regulations, state laws, and professional boards mandate reporting.
For additional information on developing a drug diversion prevention program, view the supplemental module titled Guard Your Meds. For more information on drug diversion, visit the following websites or click on the links in the description box below. We would like to thank the National Association of Drug Diversion Investigators for use of their materials to develop this webinar.